Hello everyone, today we will talk about the second part of auricular acupuncture therapy, the concept and application of auricular points. Firstly, let us have a review of the concept of auricular acupuncture. It involves the stimulation of specific points on the auricle, front or back side with small needles, intradermal needles, or small pebbles, the vacuole seeds that are tipped on the points. Sometimes we can use fingers to press the auricular points to prevent disease. Then, before using ear acupuncture to treat disease, we should know the specific position and application of auricular points. As we said in the last content, from the anatomical level, the front of the ear can be divided into 8 areas, respectively helix, antihelix, scaphoid, triangular fossa, auricular concha, triggers, anti-triggers, and the earlobe. And here we will talk about some representative points of each area in details. First point on the helix, 耳尖. The English name is ear apex. It is located at the apex where the ear is folded forward, at the juncture of area 6 and 7 of the helix. We could use this point to treat fever, hypertension, acute toothache, and so on. When the stream point is belong to the scaphoid area. It is located anterior to the helix tubercle at the junction of scaphoid 1 and scaphoid 2. It can treat allergies, asthma in clinic. 交感, the English name is sympathetic, which is at the antihelix. It is at the junction of the end of the inferior antihelix crus and the medial edge of the helix. We usually use this point to treat spasm of the stomach and intestines, functional disorders of autonomic nerves. 神门, it is a point on the triangular fossa. This point is at the upper part of the posterior 1/3 of the triangular fossa. It can mainly treat insomnia, withdrawal syndrome, hypertension. Heart point is belong to the concha. It is at the center of the depression of the curved concha. The indication of this point is angina, arrhythmia, neurasthenia, and others. The another point which belongs to the concha, we call it stomach. It is located at the end of the helix crus. It can treat gastric spasm, gastritis, indigestion, and other diseases. The last point, which in the earlobe, we call it eye. This point is located at the center of the front surface of the earlobe. We usually choose these auricular points to treat myopia. After mastering some common auricular points, let's talk about some basic operations and clinical applications of ear acupuncture therapy. First one, according to the diagnosis to determine the prescription and appropriate auricular points. We could choose some auricular points to treat disease. Secondly, besides disinfect the needles and fingers of doctors, The auricular points should be swabbed with 2% iodine, and then wipe 75% alcohol as routine asepsis. After that, we need to consider the specific operation method of auricular therapy. Since we have talked about that, we could choose small filler foam needles, intradermal needles to treat disease in the ear. The vacuole seeds can be also used. In Chinese, we call it 王不留行. They are fastened to the ear with a piece of adhesive tape on the auricular points and kept in place for 3 to 5 days. The patient is asked to press the selected points 2 to 4 times a day. This method is more convenient and it is also easier to be accepted by patients. Of course, there are some situations that are not suitable for treatment with auricular therapy. For example, auricular acupuncture should be contraindicated for pregnant women or women who are prone to abortion. It is not recommended for patients with severe disease. In the treatment of severe heart disease or severe hypertension, strong stimulation should be avoided. Thanks for listening.